Yeah, so thanks for that introduction. So I'm with NeuroTalk, and we're just like an interdisciplinary assembly of students within neurotech at Berkeley. And we basically pick the brains of thought and industry leaders in neurotech, including professors and leaders of companies such as you guys. And we have the goal of shining a light on gray matters at the junction of the brain and technology. So hopefully we can really dig into your product and your company and what sets you guys apart. Would you mind giving me an introduction again for our viewers?
Okay, absolutely. About myself, my name is Sarah. I graduated from UC Berkeley undergrad, major in industrial engineering and business, and then went to Harvard for grad school, major in data science. I worked in finance field for 3 years, and we started BrainUp back in 2018. A little bit about BrainUp. We focus on brain technology, especially in BCI. In the past 2 years, we've done a lot of infrastructure work, and also we launched a lot of different products, from sleep to a medical device, to security helmets, to Dream, a lot of things. We're also paired with different universities around the world to do the basic research in BCI and brain technology. We are right now ranked as China's definitely #1 BCI company in the field. Our vision is to actually to see BCI as the next generation interaction way between people. Yeah, we've had 4 rounds of fundings, and this is a really fast growing phase for the company. So we would like to see all the talents out there who are interested in the field, and welcome to join us.
Great, thank you. Yang, would you like to give an introduction as well?
Yes. Hello, Luke and everybody. My name is Yang, and I joined BrainUp a little over half a year ago. I did my undergrad at UC Berkeley, majoring in mechanical engineering, and then did my PhD in Oxford, focused on minimally invasive medical devices. And now at BrainUp, I'm doing product R&D.
Yeah.
Great, thank you guys so much. To get us started, hopefully we can hear a little bit about you guys in comparison to your competitors. Neurotech is a really growing space right now, and I want to know what sets you apart from other BCI companies, especially those competing in the EEG sector, such as Neurable, but also in some like sort of high advertisement names such as Neuralink with Elon Musk.
I guess there are several different aspects. The first one, I think we are really focused on the non-invasive BCI technology, and to be able to put it, to enhance it in people's everyday life. This is what our company does. So that means that we're not only focused on like the research or the science part, but we also focus on like the product part. So after the launch of our sleep product and also other business partnership products, I think in a lot of different fields, our partners can see the value of EEG in a pretty short scan. I think that really differentiates us from Neuralink or the other invasive or high science part company. Yeah.
Great. So you mentioned the breadth of your product, and I know that you guys are targeting a few different industries. Would you mind mentioning which industry is really leading the pack? Maybe talk a little bit about your sleep device.
Sure. For our sleep product, I think the sleep product is leading the pack in China at the moment. It is a real-time sleep monitoring and regulating system that monitors your sleep using EEG and other biometric measurements, and also use personalized sound wave to enhance your sleep. Yeah, that's the sleep part. And for brain and mental health screening, we have a also portable and convenient system to screen Alzheimer, Parkinson's disease, mood disorders, and etc. to help patients to get early treatment.
That's really amazing to hear. And I know that you have your EEG device on you. Any chance you could give us another display of what that looks like? And also, I know that you have 7 nodes in it. I was wondering why you guys chose to do 7 electrodes, not more, not less, and also why you chose to place them where they are.
Right. So on the front, we have, I'm not sure if you can see, we have 5 electrodes here, and this one measures your heart rate and your SpO2. And then on the back, we have another 2 other electrodes. This design came from, more or less come from the gold standard PSG, where you have 6 electrodes, 2 on the front, 2 on top, and 2 in the back. During the R&D process, we have collected data and trained our model together with the measurements from Philips PSG, and our accuracy measures up at least 90 to 95% of the actual PSG device.
Great, thank you so much. And again, would love to see the demo of that if possible. I know our viewers would be stoked to see.
Right. Okay. Sorry.
No
So this is how you turn it on. There's a button right here, and then usually during if you're in a sleep clinic and use a clinical PSG, it would take half an hour to 1 hour to set the whole thing up. And for us, it was just 5 seconds. And then you open the app, and it's already connected. And here is the real-time brain signal. Should I go through the close my eye thing again?
Yeah,
that'd be awesome.
Yeah.
Okay. And I blink my eyes and clench my teeth.
That's awesome. And you guys mentioned that was an alpha wave, one of the electrodes you chose that sort of best represented activity, correct?
Yes, this is in front.
So there's some pretty deeply embedded fear in public with using BMIs, and a lot of that pertains to issues in cybersecurity and neurosecurity. I was hoping you guys could touch on that and how you hope to address those concerns. So there's a lot of deeply embedded fear in the public at large and also in neurotech rhetoric. Those particularly pertain to cybersecurity and neurosecurity. People are afraid to put a device on their head that they know is tracking them. Could you guys maybe talk about how you're addressing this, how you store your data?
Right. We for all our products, we follow the regulations, and we conform to CFDA, which is the Chinese version of FDA, and we store our data on a secure server and make all personal data anonymous. And I think the fear is universal for all kinds of personal electronic, consumer electronic devices, that your phone tracks your daily location, who you are talking to, and even record your conversations. Whereas I think for us, your brain EEG activity is harder to decipher actually. So um, with the regular practice, we don't see any problem with cybersecurity.
Great to hear. It's comforting in light of recent cyber concerns with Facebook and TikTok and the like. So another question, and this can pertain to either the technology or business development, but I'm really wondering, what's the biggest issue you faced while starting BrainUp?
Because we started the company in 2018. Back then, there isn't NeuroCollege or NeuroX. Not many students or people know the field. So attracting talents to tell people what we wanted to accomplish was one very hard thing at the very beginning, to form the team. And the second would be when we launch our products, we partner with different industries. We have different partnerships to educate people, experts from other fields about EEG, what brain science is and what it can, how it can add value to their current products. That's another, I wouldn't say it's obstacle, but it's definitely something that other startups or other industries wouldn't need to do. So those two are pretty unique about doing a company in BCI.
Yeah, that's definitely interesting, having to teach your coworkers about the industry at large. And hopefully that will get better moving forward as we see more and more people get involved with neurotechnology. And this places you guys at a really amazing spot because you're at the forefront of the field. So that kind of leads me to ask about the future of the company, and what is one of your products that you're most excited for? And also, what do you think more theoretically would be possible with your products down the line?
For myself, I'm most excited about the Dream product that right now for Calm Sleep, we are basically doing a portable and comfortable version of PSG that help monitors and improves your sleep. But to detecting your dream and reconstruct your dream is something that has never been done, and we are looking forward to do it in both scientific and artistic way.
Yeah, for me, I'm very looking forward to the portable EEG device to be able to use in families, because we have all the portable medical devices for other to measure other parts of the body, but not for your head. For your brain. So our portable medical device, EEG device, it also has already launched and will be out in the market this year. It will have a pretty good market share in that way, and it can detect, for example, Alzheimer and also depression, all kinds of different brain diseases. I think that's a very valuable product.
It's very exciting and very real world applications. So we hear a lot of sort of hyper theoretical and almost fantastical sort of theories about implementations of BMI, and those things really do seem like they're almost possible. When do you think those types of technologies might be implemented or start to enter the market?
The medical device has already launched, and we are working on the market, the sales this year. It launched 1 to 2 months ago. Yeah, and the Dream one will come out in May or June.
Really exciting. And then another couple of questions. You both did your undergrad at Berkeley. I was hoping you guys could give some advice and maybe also talk about how your experience at Berkeley affected the trajectory of your career and led you towards neurotechnology.
My experience at Berkeley, I think, aligns with what I do very well. I double majored in IEOR, Industrial Engineering Operations Research, and business. So I applied to Haas the end of sophomore year. So the cross discipline experience gave me a lot of idea of how to use, how to combine engineering or science with business. So you can't, if you want to do a startup, you can't only focus on the science part, or you can't only focus on the business part. It's about the balance. So I would encourage all the call-bearers, if you have a chance, try to take classes outside your discipline. That would be definitely helpful.
Yes, I couldn't agree more. I was majoring in mechanical engineering, and as you may know, the core curriculum is rather full. Like all the classes, almost you have your 120 units all in the same in engineering departments. And if I were to do it again, I would take more fundamental classes in math or physics. I think that really builds you a good foundation to do anything in the future.
Great advice. Thank you guys so much. That totals up my questions, and we're nearing the time cap. I wanted to hear if Jack or Melina, am I pronouncing that correctly? If you guys had any questions.
Leland, if you have any questions, go ahead. I already asked too many today.
No, yeah. Thank you so much to you all for the really great talk, and I learned a lot. I think maybe one question that I have is for students who are maybe considering kind of the neuroscience field as well. Do you think it's valuable to go into academia and get a PhD before exploring the neurotech industry, just to build kind of a really strong foundation in that area?
Yeah, I think it's never a bad idea to get a PhD. Not only the research part of it, but also while you stay in school, you have so many possibilities and you can explore a lot of things.
Yeah. I mean, I guess I guess something that that actually was a question that I was thinking. Should I go into neuroscience, spend 5 years of my life going out a PhD? And actually, I was talking to a lot of BCI company founders about this, and it's almost like you see a trend, right? Back in the 80s, only the computer CS PhDs were starting internet companies, right? Everybody had one. Like that was like the bare minimum, right? And but gradually, when it came to the 90s, when it came to the 2000s, you gradually started seeing, sort of graduate students or even undergrads like Mark or Basil starting their own internet company, even with sometimes with little CS background. Just because simply the CS technology is more mature, the founders themselves don't need to be, I think, they need to understand the technology, just not, they didn't really understand 99% of everything. They needed to understand 70%, 60%, just not 99%, as a PhD will allow you to do. And I do see that is becoming a trend in BCI as well. Definitely for some of the BCI companies that I talked to, ones that were started back in like 2012, 2013, or 2015, like yeah, like it was mostly all started by PhDs, like Paradromics that started by Stanford PhD. In BrainUp we have Roy, and NeuroCollege had like 10, 15 even professors. Oh, sorry, Neuralink had like 10, 15 professors were like PhDs working with them. But gradually in 2018, we have BrainUp, and then gradually what we see today, I think eventually we'll see people with little neurotech experience starting their own companies for sure. And that's just my take. Yeah. Yeah, okay. I think Yeah, Luke, do you have any other questions?
That does it for me.
All right. No, really appreciate everybody coming here today. And tell Roy that we really super appreciated him coming today, even though his wife was giving birth.
Yeah, he is in hospital right now.
No. Wish him good luck for us.
Yeah.
Yeah.
Thank you
All right.
so much.
Thank you. Thank you.
All right. Thank you guys.
Thank
Appreciate it.
you. Thank you so much.
Okay.
Thank you.
Thank you, everyone.
Congratulations.